In 1977, 3 Canadian physicians called Arthur Birt, Georgina Hogg, and James Dubé were studying a large family when they found a type of benign skin lesion that acted as a dominant trait, meaning that the children of affected individuals had a 50% chance of inheriting it. 15 out of 37 family members had these lesions.
Well, we'll need to give it a name.
Yes, something simple and short.
I've got an idea. What about Birt-Hogg-Dubé syndrome?
Well, could my name come first?
No.
But the skin lesions weren't alone. Later research found that this was part of a rare syndrome that is also linked to cancer. So what is this syndrome, and what should we know about it? It's not that complicated. It's simply rare. 3 different affections are common in this syndrome. Fibrofolliculomas are a type of benign skin lesion that appear between the 2nd and the 4th decade of life, usually in the face and neck area in over 85% of the cases. Pulmonary cysts, usually in both lungs, in about 70% of individuals. They can remain stable all through life, but they also can burst, leading to a pneumothorax, where patients usually experience sudden chest pain and shortness of breath. And renal cancer, the main villain here, which can occur in approximately 20% of the cases. And it is particularly worrying as the cancerous lesions tend to be multiple and affect both kidneys. Took scientists 35 years to discover the culprit, a mutation in the FLCN gene. This gene codes for folliculin, a protein that is involved in a number of complex processes in cells, but we're not going to bother you with the details. The important thing is that from that point onward, scientists had a way of identifying the carriers of the mutation, a genetic test. And to pinpoint who has the syndrome, clinicians look for individuals that have multiple skin lesions with at least 1 confirmed fibrofolliculoma, multiple pulmonary cysts in both lungs, recurrent spontaneous pneumothorax or a history of pneumothorax in the family, renal cancer on both kidneys, or multiple cancers in the same kidney or at an early age, a family history of renal cancer, or any combination of these manifestations in oneself or in family members. These individuals are offered the genetic test, and although there is no available cure, science can offer surveillance plans and treatments that greatly minimize the risks. Although fibrofolliculomas pose no danger, they can be removed by surgery or laser, if so desired. All carriers are offered a chest CT scan to detect possible lung cysts. Cysts tend to remain stable and not affect normal lung function, but there is, however, a high risk of spontaneous pneumothorax. For this reason, individuals are advised not to smoke, to avoid high air pressure activities such as air travel or scuba diving, and also to avoid radiation exposure. Given the risk of kidney cancer, close surveillance is offered with an abdominal MRI every 2 years from the age of 20. If a tumour is detected but is smaller than 3 centimetres, surveillance is maintained on a tighter schedule in order to preserve kidney function as much as possible. Lesions are only removed above the 3 centimetre threshold. Medicine can also offer pre-implantation genetic diagnosis, allowing the transfer of embryos without the mutation, effectively putting an end to this syndrome in coming generations. There is much to offer to families affected by Birt-Hogg-Dubé syndrome. With proper care, every carrier can lead a long and fulfilling life.
Great job, everyone.
Yes, splendid.
And now we can work on the name, right?